Let's talk about trauma and how you can help your child who has experienced trauma in their life. So what is trauma exactly? Throughout the rest of this video, we will cover more about what the traumatic experience is, what it can look like, how it impacts your child, what some behaviors can look like, as well as what you can do to help your child who has experienced trauma. Let's first start by defining trauma. Individual trauma can be a result of either an event, this could be actual or threatened, a series of events, or a set of circumstances that is experienced by an individual as physically or emotionally harmful or threatening. This will then have lasting adverse effects on the individual's functioning and physical, social, emotional, or spiritual well-being. As a foster or a biological parent, understanding what trauma is and how it can affect your child is extremely important. Traumatic experiences for children in foster care may include a child being abused by their parent, a caregiver, or another relative, a child experiencing unsafe living conditions due to reasons such as an extremely dirty house or the participation of illegal drugs within the household. It can also look like caregiver neglect, which means that the child is not given basic necessities of life, such as consistent meals throughout the day. And last, a youth in care can be abandoned by their family members. This is obviously an extremely traumatic situation for them, as well as the other traumatic experiences that we talked about earlier. Traumatic experiences like these can have lasting effects on the physical, psychosocial, and mental health of a child. This can include sensory processing disorders, language disorders, poor social adaptive skills, delayed fine motor skills, behavioral disorders, attachment disorders, self-concept issues, and cognitive delays. However, children are very resilient, so just because they have experienced a traumatic event in their lives, that doesn't mean that they will automatically have these difficulties, but they may be at higher risk of developing them. All children in foster care have experienced some form of trauma. Even the act of being separated from their families can be traumatic for them. However, many children in foster care have experienced repeated trauma, which is really important to remember when parenting a youth in care. Knowing all of that, how else can trauma affect your child? As mentioned earlier, trauma can have a lasting effect on their brain development. This just means that trauma can leave permanent damage on a child's brain, which impacts the connections a child makes throughout their lives. Repeated or continuous trauma can weaken some of the child's logical thinking connections, but at the same time, it can strengthen their survival connections, making it harder for them to cope with adversity even as they grow up. Similarly to brain development, trauma can have an impact on your child's physical development, meaning it can possibly lower their immune function and they could have an increased risk of physical illnesses into adulthood. Trauma can also affect your child's ability to form secure attachments within relationships, either with peers, family members, or other adults in their life. Also, trauma can disrupt a child's sense of security, safety, sense of self, and alter the way that they interact with the world around them. Research shows that 1 in 4 children in foster care will show signs of post-traumatic stress disorder, or PTSD. Many of the behaviors they are displaying are most likely deep-rooted protective mechanisms that they developed as a result of trauma. In the next part of this video, we will cover what these behaviors may look like for your child. Some common behaviors that you might see as a parent that are related to trauma include increased aggression and defiant behaviors, such as tantrums, fighting, or increased bullying at school. Your child regularly distrusting or disobeying adults or other people of authority. Them startling easily or difficulty calming down after being startled or frightened. Becoming increasingly quiet or withdrawn and wanting to be left alone regularly. Their behaviors could also look like a regression and increase in behaviors common in younger children, such as thumb sucking or clinging to caregivers more often. Trauma can even influence behaviors such as hiding or hoarding food, only eating one type of food, eating a lot at one time, or not eating enough. They may also show changes in sleeping habits or difficulty sleeping. This can include bedwetting, increased fear of the dark, or an increased amount of nightmares. Now we've covered most of the common behaviors that you might see for your child who has experienced trauma in their lives. The rest of the video, we're going to go over some tips, tricks, and strategies to help your child heal from the trauma and help you as a parent be the supportive factor in their life that they need the most. Now let's talk about what you can do to help. First and foremost, try to be patient with your child and not take traumatic behaviors personally. Remember, they're trying to adjust to a number of changes and dealing with all that they have already experienced in their short lives. One of the most important concepts that you should take away from this video is help your child feel safe. As a parent, creating a safe environment both physically and emotionally, creating a set of boundaries and trust, supporting a child's choices and cultivating their autonomy, creating opportunities for them to participate in meaningful activities, and focusing on the child's strengths while empowering them can all reduce re-traumatization and promote positive healing. When things get a little hectic and you know that they can, try to remain calm and create a daily routine. This can include meals at specific times, playtime dates, and bedtime routines. Also, encourage, but try not to force, your child to talk about their feelings. Reassure them that it's normal to have certain feelings in certain situations, and reassure them that anything related to the trauma that they have experienced is not their fault. Another way to help your child is follow their lead and pay attention to their cues. Allow for them to make choices and have some sense of control in their lives. A child who feels they have no control may display more challenging behaviors. Also, provide extra encouragement, attention, and comfort for them throughout the day. You can also help by providing them with coping and calming strategies. Some strategies can be practicing slow breathing, listening to calming music, taking some time alone, taking a bath with calming scents, anything that you know that may help your child relax. And last, but definitely not least, be aware of your own response to trauma. Your own life experiences may impact how you respond to your child's trauma. Seek outside help if you feel overwhelmed or if you just need a little bit more support. And remember, with patience, support, and care, children and families can heal from trauma. Thank you so much for taking your time to watch this video. If you want to know more on trauma, you can visit Lawrence Hall's website.